Brine.
Spoiler alert to start, I will be voting to give the Tobacco and Vapes Bill a second reading this evening. As we might say, prevention is the new cure. I'm not going to spend my time reading out the screed of statistics that we've already heard. Bottom line, smoking is the only product on sale legally in our country today that if you follow the instructions, it will kill you. Now, both Labour and Conservative governments have acted in the past. We've seen smoking rates tumble as a result. I think it's time to finish the job. This bill can be part of that. So here's where I'm coming from. We talk a lot, indeed there's been some new waiting list figures published while we've been away about the pressure on the NHS. We talk about public satisfaction, and colleagues will be aware of the latest British Social Attitudes Survey last month. We talk endlessly about systems, about budgets, about staffing. All quite proper. They're all issues that my select committee doesn't duck any of them. Now, we can increase the budget, Mr Deputy Speaker, and we have hugely. The NHS in England has never had more money. We can put in place a properly funded workforce plan, as my committee called for, and we have. We can produce credible recovery plans for urgent emergency care, for primary care, for elective waiting lists, and the government, to their credit, have done all of them. We can make much use of a wider workforce. Pharmacy First is a good example. But the truth is, demand continues to outstrip supply, and we cannot continue to increase the health budget faster than our economy is growing. We have to think long-term about population preventative health. Now, for me, there is no more obvious and glaring candidate for healthcare gains from prevention than action against smoking. So the question that I ask when I'm looking at this legislation is not, do we want to finish the job on smoking, or is it right to save tens of thousands of lives lost to cancer, heart disease and stroke by doing that? I lost both my parents before I was 50 to cancer. It's, will the proposed measures aimed at creating a smoke-free generation actually work? Also, how strong is the resolve of ministers to swiftly use the powers they're taking in this bill to tackle the use of vapes among children? And often overlooked, too often overlooked right now, will we keep the focus on current smokers who we must help to quit? Now, modelling from the department shows us that if the age of sale were increased by 1 year every year, as proposed in this bill, smoking rates among 14 to 30-year-olds are likely to be zero by 2050. I've said this since the Prime Minister announced his intention to bring forward these measures in his conference speech last year, and he deserves so much credit for bringing this to the House. The government has to win the argument on this, as well as the vote, now the bill is before Parliament. And I think the Secretary of State, who's no longer in her place, did that today, and credit to the Shadow Secretary of State for his part in that. But I did just want to touch on the issue we've already heard of today. The fact is, we will indeed, we will have a situation at some future point where a 50-year-old can legally smoke while a 49-year-old can't. There's no getting away from that. That's a possible scenario for sure. And yes, it is rather inelegant. But it also misses the very point of the smoke-free ambition of this bill at its very heart. There's a clue in the name, Mr Deputy Speaker: smoke-free. This bill doesn't criminalise existing smokers, and it ensures the purchase of tobacco by those under the legal age of sale will not be criminalised by this legislation. Compliance will be a responsibility of the business, as is the case with the current age of sale laws in England. And it makes it illegal to sell tobacco products to anyone who is born on or after New Year's Day 2009. That includes my 13-year-old son William. By passing this legislation, the state is saying to him, it's not okay to start smoking when you reach 18. And I think we will look back, when we look back, we will ask, how did we ever say it was? And by doing so, Mr Deputy Speaker, my son never becomes that 49-year-old. End of story. Now, we're told that raising the age of sale will just fuel the black market, and the next generation of smokers will pick up the habit via illicit sales. A comprehensive anti-smuggling strategy, updated over time, has succeeded in halving the illicit market share from 22 to 11%. And I welcome the fact the anti-smuggling strategy of Border Force and HMRC has been updated in the light of this proposed legislation. Now, am I just being hopeful in thinking that this will work? Select Committee chairs don't just do hope, we have to do evidence. I don't think so. When the age of sale was raised from 16 to 18 in 2007, the illicit market did not increase. Now, of course, all of this, and as I said, we must continue to give help to quit advice to current smokers, it needs funding. And I welcome the £70 million a year for the next 5 years into stop smoking services. But that's a lot of money. So I can't for the life of me see why ministers don't look again at the Khan Review call for a polluter pays principle, tobacco industry levy, make that a reality. Absolutely. Let me just turn to vapes, Mr Deputy Speaker. The bill gets 10 out of 10 for intention, but on planned enforceable action, not so sure, because we just don't know enough. Increasingly, the genie's already out of the bottle here, or if you prefer, the unknown, untested, bubblegum flavoured canister when it comes to vaping. But the kids, Mr Deputy Speaker, are not all right on this. Let's make no mistake. These are mostly youngsters who will seldom these days even think of trying the fags. Vapes are no longer only or even principally aimed at adults trying to quit cigarettes, of course. Just when smoking by children was decreasing, vaping by children has started to rise hugely. Between 2018 and 2020, vaping rates have doubled. Now, the benefit of vaping as a safer option for those who currently smoke tobacco is clear, but it's also increasingly obvious that for those who've never smoked, it is certainly not risk-free. The WHO has said vapes are harmful. Schools are worried. Any colleague can talk to any head teacher in their constituency and they will tell you. In my committee's oral evidence hearing on vaping, our witnesses raised repeated concerns about the health and behavioural effects of vaping-led nicotine consumption and addiction in schools, such as concentration in class. The long-term effects of vaping are simply not known. So I cautiously welcome the bill taking, as it does, the powers to really crack down on youth vaping through the regulations to restrict flavours, the point-of-sale displays in retail outlets and the packaging. But I can't go further, Mr Deputy Speaker, because throughout the bill it says the Secretary of State, quote, may by regulations make provision. And by virtue of the fact that we don't have those regulations in front of us, it's hard to get a sense of their scope. So could the Minister update the House when she winds up as to when we might see those regs? Pleased to see the new excise duty on vaping products to discourage non-smokers and young people from vaping, but on the sale and supply of disposable vapes, I know DEFRA will lead on that ban, and I note the environmental protection draft regs has been out to consultation up until the end of March when it closed. Again, grateful if the Minister can update the House on when that will be taken forward and clarify if this requires the bill to receive royal assent before it can be. Obviously, I understand the environmental case for a ban on disposables, but I do have concerns about us taking a ladder away from adult smokers to climb down. We must be super careful, Mr Deputy Speaker, that for those adults who use vapes to quit cigarettes, we don't tip them back to smoking by taking away options. Now, some talk of a retail licensing scheme. We heard it earlier from the Secretary of State referring to that. And you could perhaps disregard such a scheme if you went down the road of a prescription-only vape, so they're only used under clinical guidance to help adult smokers quit. In truth, I don't think our current regulatory environment, courtesy of the MHRA, makes it very easy to bring a prescription vape to market. The speed of innovation in the sector, alongside the slowness of the regulation, makes it a real challenge for providers. So unless ministers want to address this, I don't see how we can advance the cause. In conclusion, we will hear today, certainly we have on the media, about banning things. We will hear about the nanny state, perhaps even an echo from the distant past, Mr Deputy Speaker, about Anglo-Saxon England. Well, as the MP representing the capital of the former Kingdom of Wessex, I don't hold much truck with that. I prefer to listen, foolish that I am, to the 4 CMOs of our nation who say to be pro-individual choice should mean being against the deliberate addiction of children, young people and young adults to something that will harm them, potentially fatally. I have always believed, Mr Deputy Speaker, that in a publicly funded healthcare system we have a right, and I would say indeed a responsibility, to act on public health, because it becomes everyone's problem when we don't. If you're a Conservative and a smaller state is your thing, although I never can pinpoint which part of the state many people don't want their constituents to have, you should be right behind a healthier society. One that needs the state less, one that relies on the state less, one that costs the state less.
Absolutely.
Anyway, to close, with the important points that I've raised, tried to cover this afternoon, I will be voting for this important, historic bill at second reading.